I'd like to welcome everyone today to our webinar entitled Managing Mastitis in Bred Heifers. Today's webinar is sponsored by DAIReXNET and Unity Extension National Initiative. I'm Donna Amaral Phillips, Extension Dairy Specialist here at the University of Kentucky, and I'm also the project leader for DAIReXNET. Today's webinar is on mastitis, and all of our webinars, including today, are available through our archive page, which is available at the bottom of the screen, which you can actually click on, and you can actually view all the webinars that we have produced over the last 2 or 3 years. To get upcoming information about future webinars and also what we have new on our website, we encourage you to look at Facebook, sign up through Facebook, or sign up for our newsletter. You could also follow us on Twitter to get common updates as far as what we have ongoing. As I said, today's webinar is on managing mastitis in bred heifers. We're very pleased today to have Dr. Steve Nickerson from the University of Georgia. He is a professor there in lactational physiology to have this presentation. He basically received his master's and PhD from Virginia Tech, and after a couple stunts as a postdoc, he actually joined the faculty at LSU, where he directed the Mastitis Research Laboratory for over 20 years. In 2001, he took a position at Virginia Tech and then moved in 2004 to the University of Georgia at his current position. His research and extension activities have focused traditionally on mastitis control and milk quality, but more recently he has focused on immunization techniques and dietary supplementation to improve the cow's immune system. We're very honored to have Steve here today to actually make this presentation. Thank you very much, Steve.
Thank you, Donna. As a researcher in dairy production, one of my goals is to enhance both milk yield and quality among dairy cows. And mastitis management in bred heifers becomes part of this goal, again, because we want our heifers to calve with maximum yield and the lowest possible somatic cell counts. And the fact is, most of these animals will have some type of mastitis, which again may reduce milk production as well as milk quality during their first lactation. So what I'd like to do during the next 30 minutes is to emphasize the prevalence of this disease among dairy heifers, how it can be treated with antibiotics, and then more importantly, how this disease can be prevented through use of teat seals, fly control, vaccination, and dietary supplementation. The problem has been that most people still regard young dairy heifers as uninfected. They don't notice mastitis until the animal calves or at the first clinical flare-up during their first lactation. But we've got to remember that these animals represent the future milking herd. They also need an udder health program, just like adult dry and lactating cows do. In some herds, greater than 75% of the heifers will have some form of clinical mastitis. And I'm talking about breeding age animals, 12 to 15 months of age and older. 20 to 30% of these animals can have Staph aureus, with cell counts in the developing udders of greater than 10 million per mil. The trouble is, few of these animals will exhibit clinical symptoms of mastitis, such as swollen quarters. Most of these udders look perfectly normal, but they're subclinically infected with mastitis-causing bacteria. Heifers are exposed to mastitis-causing bacteria at a very young age. Shortly after birth, the neonates' teats become colonized with mastitis-causing bacteria. They carry these bacteria through their prepubertal stage, and by the time they're breeding age, 12 to 15 months of age and older, they already have mastitis. They carry these infections through pregnancy and into their first lactation. So if we consider that a heifer is bred to calve between 2 to 2.5 years of age, this is a quarter or a half of their lifetime in which there is no udder health control at all. So if these animals get mastitis, their milk yield is going to be decreased during the first lactation, along with an increase in their somatic cell counts. But again, this is the future milking herd we're talking about. They need another health program. Well, how do these young animals get mastitis in the first place? They're not exposed to older cows through milking equipment and so forth. The trouble is, normally teat surfaces covered with bacteria, especially the Staphylococci colonize teat surfaces, which places them in an opportunistic position to cause an intramural infection. Now, there is a keratin plug at the base of the teat that does serve as a physical barrier to bacterial penetration. And in the middle picture, you can see where the keratin plug is actually being extruded so that you can see it. Although it serves as a physical plug, keratin also supports the growth of bacteria. In fact, if we were to take a swab and swab the end of a heifer's teat and plate it in the laboratory, you can see on the right where this plate is covered with Staphylococcus aureus. That's been isolated from that teat canal keratin. So bacteria grow in the keratin plug. They actually move into the teat cistern, multiply there, and eventually cause an intramammary infection, or mastitis. In addition, horn flies serve as a vector for carrying Staph aureus to heifer's teats and eventually resulting in the development of mastitis, which I'll explain in a few minutes. If we look at the mammary quarter infection rate among heifers, it's typically about 60%. So about 60% of the heifers will have quarter infections. Most of these infections are caused by Staph aureus. Also, other Staphylococci are responsible, such as Staph chromogenes, Hyacus, and Staphylococcus simulans. We see very few environmental streptococci infecting heifers' udders and virtually no coliforms in these young animals. The thing is, all of these infections are associated with elevated cell counts in these developing udders, and elevated cell counts are always associated with a decrease in future milk yield. So let's look and see what happens inside an infected quarter. This is actually an udder of a heifer in her first trimester of pregnancy, and we're looking at a cross-section here of an udder that's been infused with green food dye. Now, if we look at the front quarter, this quarter is uninfected. The green food dye is pretty well distributed through that udder tissue. If we look at the rear quarter that's been chronically infected with Staph aureus, the green food dye is far less distributed. You can see there in the center where the oval is, this is scar tissue that the green food dye could not penetrate. The scar tissue is in response to Staph aureus infections. This tissue exhibits reduced secretory potential. So when that heifer calves, she's going to have lower yield during her first lactation, and that staph could spread to the lactating herd. Typically, a heifer with one or more quarters infected with Staph aureus will produce 10% less milk during her first lactation. And this is the difference between a 20,000 and a 22,000 pound animal. So knowing that the greatest development of milk-producing tissues in a dairy animal occurs during that first pregnancy, we want to protect these heifers from mastitis-causing bacteria in order to ensure maximum milk production during her first lactation. So, if mastitis is suspected in these young animals, for example, if we see swollen quarters or scabs on the ends of teats as a result of flies, then these infected quarters should be treated with some type of antibiotic. And we have both lactating and dry cow products that can be used here. This is a list of dry cow products that have been used in heifers. They all work equally well. The thing is, we want to treat prior to 30 days prepartum in order to avoid residues from the antibiotic. When using dry cow therapy in heifers, we want to make sure that the teat orifice is sanitized with alcohol to remove any contaminating bacteria. We want to use the partial insertion technique when infusing drugs into that quarter, and I'll explain this in more detail later. And finally, we want to go ahead and dip that teat in a germicide to kill any contaminating bacteria at the teat end. But through dry cow therapy in heifers during pregnancy, the cure rate against Staph aureus is typically 90 to 100%, which is really high. Cell count is reduced about 50% at calving in comparison to untreated controls, and milk production is typically increased by 10%. In addition, by eliminating the infection, we reduce the spread of Staph aureus to the lactating herd. As far as the best time to treat, during pregnancy checks, heifers can be treated, hoof trimming, or when moving to the close-up lot. It's easy to run these animals through a chute and treat. What must be remembered that this basically is extra label use of drug, and it does require a valid client-patient relationship with your veterinarian. Lactating cow products can also be used. I've listed them here that have been tested in dairy heifers. Again, we want to treat no sooner than 14 days prepartum to avoid residues in milk when the heifer freshens. An example trial was done at the University of Tennessee several years ago in Dr. Steve Oliver's lab. They found in their university herd that 73% of their Holstein heifers were infected with mastitis-causing bacteria about 2 weeks prior to calving. So they treated them with two products. They had a penicillin novibacin product, which is your albicillin, or perlomycin, which is Pursue. And then they determined the cure rates at calving. And they found that with the albicillin product, they had a 76% cure rate, and with the Pursue, about a 59% cure rate. In the same university, they also found 96% of their jerseys were infected 2 weeks prepartum. They treated these heifers with the same drugs, again, determined the cure rates at calving, and found, again, with the penicillin product, the albicillin, they had a 75% cure rate and an 87% cure rate with Pursue. They also looked at milk production during that first lactation in these heifers, and they found that both Holsteins and Jerseys that were treated with antibiotics produced 10% more milk during the first lactation. Now, whether we use dry or lactating cow products in heifers, we must follow proper drug infusion methods. When most people treat heifers, as well as cows, they want to take that infusion cannula and insert it all the way into that heifer's teat canal. And this is a bad practice because by inserting the cannula fully, you're going to stretch the sphincter muscle, dilate the teat canal, and remove that protective keratin. In addition, by placing that cannula all the way up into the teat canal, you could be introducing bacteria from the outside of the gland to the inside of the gland. These are typically environmental bacteria such as E. coli that are resistant to drugs. So in addition to treating, for example, a Staph aureus infected quarter, you could actually be causing a new infection by introducing E. coli into that quarter by using the full insertion technique. So what we recommend is partial insertion of only the distal 2 to 3 millimeters of that cannula into the teat orifice. This is going to maintain the normal tissue architecture of the teat end and minimize bacterial entry into the gland because we're not shoving that cannula all the way up. Only the distal end is being inserted into the teat canal. Now, to this point, we've been talking about treatment of existing infections in these animals, but let's focus now on prevention of this disease in dairy heifers. One way we can prevent new infections from occurring is by using internal teat seals during the prepartum period. These are typically bismuth and paraffin-based products that are infused 30 days prepartum and then removed at the first milking. And they have a very toothpaste-like consistency. There's a couple products on the market here in the United States. One is Orbiseal and one is Teat Seal. And they're infused into the teat and remain in the distal teat cistern and in the teat canal, basically forming a physical barrier to bacterial penetration. So bacteria simply cannot go through this barrier and get into the mammary gland to cause mastitis. And a recent study in New Zealand has shown a 4-fold reduction in clinical strep uterus mastitis in heifers within the first couple weeks of calving when they are treated with one of these two products. So teat seals work pretty well as far as preventing new infections in these animals. What about using teat seal and antibiotic together? Does the combination work better than either alone? Well, we looked at this at our UGA dairy last year. We took heifers at 30 to 60 days prepartum, and we allotted 4 treatments to each heifer. One quarter received nothing. That was our untreated control. The second quarter received antibiotic dry cow therapy. A third quarter received teat seal. And the fourth quarter received dry cow therapy plus teat seal. We used 38 heifers during this trial, and then we measured the results at calving, particularly looking at the cure rate of existing infections and the prevention of new infections. First, we'll look at the cure rate on the left-hand side of this graph here, but you can see here comparing the untreated with the treated quarters, we had a 100% cure rate when using antibiotic and 100% cure rate using antibiotic plus teat seal. This is against Staph aureus, which was significantly elevated against above the untreated control quarters. We saw a 75% cure rate using teat seal, but this was not significantly different from the untreated quarters. When looking at the cell counts in response to treatment, quarters that were left untreated freshened with a cell count of approximately 1.5 million per mil, whereas those receiving some type of treatment averaged about 460,000 per mil, or 2/3 less than the untreated quarters. So definitely by treatment, you get a lower cell count. Next, on the right side of the graph here, we looked at the prevention rate. And you can see here, among the treatments, there was equal effectiveness against preventing new infections, no differences among the treatments, all were above 93%. And it begs the question, well, why bother treating at all if treatment is as good as untreated controls as far as preventing new infections? Well, you've got to remember that 3 out of 4 quarters may be infected with bacteria. So my recommendation is always to treat quarters with dry calitherapy to cure those existing infections, and then follow that with teat seal to prevent the establishment of new infections, particularly the streptococcal infections that occur just prior to calving. And also remember, successful antibiotic treatment will lower the Semitic cell counts at calving. And that's particularly important nowadays where we're trying to get our cell count in our bulk tank as low as possible. Now, let me talk a minute about proper teat seal infusion, because some people do this wrong. What we want to do is we want to compress the area between the gland cistern and the teat cistern with our hand, because we want to isolate that teat cistern. Then we want to insert the teat seal cannula using the partial insertion method into the teat canal, and then slowly infuse the contents into that teat canal, because we want it to remain there and not go up into the gland cistern. Remember, heifers' teats are very small. They're not going to take much volume. The trouble is some people do not close off the teat cistern from the gland cistern, and they jet the teat seal into the teat, and so it ends up being farther up into the mammary gland than it should be, and sometimes it'll milk out of that quarter for days or weeks after calving. So it's important to use proper teat seal infusion methodology here. Another way to prevent mastitis is to use some form of fly control to prevent mastitis in heifers, particularly against the horn fly. Horn flies we typically find on the backs of heifers where they're sucking blood, but horn flies can also be found on the heifer's teats. In the upper left-hand side, this is a picture of a bred heifer. You can see horn flies on the ends of her teats, particularly the front teats. The picture on the upper left shows a 3-month-old heifer with flies on her teats. You can see one teat that has an abscess on the end of it, but you can see how flies can initiate abscess and then spread Staph aureus from teat to teat in these young animals. In the lower left, we see a Staph aureus infected quarter oozing some type of pus, and there's a fly there at the end of the teat, but you can envision how that fly could get Staph aureus on its proboscis and its legs, and then fly or transmit that bacteria to other heifers in that pen or in that herd, causing new infections in new animals. Well, again, horn flies live for about 3 or 4 weeks. And again, their sole purpose is to suck blood from heifers and cows. On the far right here, we see a teat with a horn fly, and it's trying to get to that capillary there, just below the surface. If we look at higher magnification of this area in the middle photograph, you can see here the horn fly, and it's about to push its proboscis through the teat skin into that capillary to go ahead and suck blood. It's just like a little hypodermic needle. But up in the upper right picture, if we look at this proboscis, it's loaded with these prongs. And I've drawn in those purple Staph aureus to show that these proboscis are contaminated. But those little prongs cause a lot of irritation and eventually form scab formation at the site of injection. In addition, these flies have bacteria not only in their proboscis, but on their leg parts, and they deposit staph on the surface of the heifer's teats. And again, that places that Staph aureus in an opportunistic position to gain access through that teat canal, multiply in the milk, and eventually cause an intramammary infection or mastitis. And that little place where the proboscis is entering the skin, I've drawn the scab there, but it doesn't really do it justice. If you really look at what scabs looks like, this is what they end up being. You see that teat is covered with these scabs caused by horn flies, and they're loaded with Staph aureus. So anytime we see scabs, we can assume these quarters are infected with Staph aureus. In fact, teat condition is a good barometer for fly control. You can see here a score 1 healthy teat on the left with increasing damage due to flies, a score 2 and a score 3. So, and these score 2s and score 3s are always associated with mastitis, particular Staph aureus mastitis. And we know that herds of fly control programs have much healthier teats and less mastitis than herds without a fly control program. Looking at this slide here, we show percentages of heifers with mastitis and herds with and without fly control. And if you look at the far right here, looking at total infections, the red bar shows the percentage of heifers in herds without fly control. You can see 100% of those heifers are infected. It's half that in herds with fly control. And it doesn't matter if we're talking about environmental streps, the coagulates negative staphs, or Staph aureus. The percentage of heifers with infections is always greater in herds without fly control. In fact, if we look at Staph aureus, you can see here there's a 10-fold increase in the percentage of animals that have mastitis in herds without fly control. So again, herds with fly control programs have much lower levels of mastitic heifers. As far as what to use for fly control, we have used porons in the past, which helps to reduce fly populations. It's very intensive because we find that we have to do it every 2 weeks to maintain lower fly concentrations and less mastitis. So again, it takes me a bunch of students out in the field to get this accomplished. But it does work, but again, very labor intensive. Another thing that can be done is to use insecticidal porons along with ear tags. For example, Epronux poron and a Patriot ear tag was found to reduce fly populations and to decrease Staph aureus mastitis by about 80% over a 6-month period when used in Jersey heifers. Another method that can be used are insect growth regulators, abbreviated IGR. An example of this would be Clarifly, which actually is a larvicide. It kills the larvae of hornflies. Basically, the IGR is placed in the animal's feed. You can see that the cow is eating some grain there that's been loaded with IGR. The IGR passes through the cow's system and ends up in her manure. And what the hornfly does is she comes by and she lays her eggs in that manure. And then the eggs hatch, into maggots, which are your larvae, and the larvae consume the insect growth regulator. And that IGR is actually the larvicide. So it kills the larvae. They cannot differentiate to the pupal stage. So there's basically no adult flies emerging. So basically we get a reduction in the fly population in that area. So fly control does work, whether it's using porons, ear tags, a combination of the two, or something like insect growth regulators. They're very effective in reducing fly populations and reducing the level of mastitis in heifers. Another way to prevent mastitis in these young animals is by immunization. You're probably very well aware of the E. coli vaccines on the market for adult cows. A less known vaccine that's out there is a Staph aureus bacterin known as lysogen or somatostaph. Not very well used in the United States, but we have done some work that shows it does work in heifers. It supposedly works by increasing antibody titers to prevent new Staph aureus infections in dairy cattle. And the question became, can we actually use this in heifers to vaccinate them against Staph aureus mastitis? And about 10 years ago, when I was at Virginia Tech, we did a small study at a 100-cow Holstein herd, had an average cell count of about 200,000 cells per mil, which wasn't bad for 10 years ago, but 20% of their bred heifers were infected with Staph aureus. So we wanted to see if we could reduce the level of staph by vaccinating these animals. So what we did was we took 106 heifers that were 6 to 12 months of age and either vaccinated half or left half as unvaccinated controls. And this next slide shows the immunization schedule. That was per label. They got their first injection at 6 to 12 months of age. They got a boost 14 days later, and at 6-month intervals thereafter, we gave another booster injection, then one final injection just before calving. All injections were given in the semi-membranosus muscle of the leg. And then what we did was we monitored the level of Staph aureus in these heifers right after they freshened. And what we found was that in comparison with controls, the vaccinated animals exhibited about a 60% reduction in the overall percentage of heifers with Staph aureus mastitis. In addition, by reducing the level of staph in these heifers, we also minimized the spread to the milking herd and helped to lower the overall cell count in that milking herd. When we looked at the cell count of the heifers, we got about a 50% reduction in those vaccinated animals in comparison with controls, and about an 8.5% increase in milk production by vaccinating these animals against Staph aureus. So immunization in this case was very positive when used in heifers, and there's other options also to boost immunity. For example, through the diet or the heifer's ration, and we've been doing that for years actually, with everything from selenium down through zinc. Probably most of the research has been done with selenium and vitamin E. But basically what these products do is they boost the animal's immune system. We have looked at selenium and vitamin E in heifers, and what it actually does is promotes the ability of their white blood cells to identify and kill bacteria. So by supplementing heifers starting 60-day prepartum, research studies have shown that we can reduce both staph as well as coliform mastitis at calving in these animals, as well as lower the somatic cell counts. So the focus here has been on this prepartum period or the periparturient period, because this is when the heifer's immune system tends to be suppressed around this time. Again, we know that mastitis increases around the time of calving because of this immunosuppression. Again, this is called the periparturient period, typically a period of immunosuppression, mainly because of the release of cortisol in heifers as well as cows. But this period of immunosuppression lasts for up to 6 weeks, and it's a period during which the innate immune system of the heifer is suppressed. That is, she exhibits reduced ability of her white blood cells, particularly the neutrophils, to identify and kill bacteria. So knowing that innate immunity is the most important defense of that mammary gland to protect that heifer from mastitis, this relies heavily on the bactericidal function of white blood cells migrating from the blood into the mammary gland. And again, knowing that that white blood cell function is compromised during these periods of immunosuppression, what can we do to boost the function of those cells so that these heifers and cows could better resist intramammary infection? Well, we know we can enhance white blood cells by using selenium and vitamin E. What about other dietary supplements such as Omnigen AF, which is a nutritional supplement to help maintain normal immune function? Well, what we found was that by supplementing heifers with Omnigen AF, we could enhance the immune system and reduce mastitis when they calved. We actually gave heifers daily supplementation of Omnigen at the level of 4 grams per 100 pounds of body weight per day, each day for 60 days prepartum. And then at calving, we made several measurements. For one thing, we measured an enhanced L-selectin receptor activity on white blood cells, both PMN and monocytes, in response to Omnigen. And that suggests that they were better able to move from the blood into the mammary gland to fight infection. We also found that these white blood cells exhibited increased phagocytosis of Staph aureus and E. coli by these leukocytes. And we also found decreased free radical generation by white blood cells in the mammary gland. This suggests that Omnigen acts as an antioxidant to help protect milk-producing cells and maintain normal production during inflammation of the udder. We also made some measurements at the time of calving and found that animals receiving Omnigen exhibited fewer health events such as retained placenta, DAs, ketosis, udder edema, and death. We saw fewer cases of mastitis in these animals and concluded that the supplemented heifers calved healthier than controls. So dietary supplements, whether selenium, vitamin E, zinc, or something like Omnigen, to boost immunity at calving have been beneficial in heifers and have been shown to promote udder health. So to summarize here, let's keep in mind that whether our heifers are young calves, pregnant animals, or close-ups, they represent the future milking herd. And producers have huge investment in these animals. Trouble is they're all susceptible to mastitis. So you need a prevention program based on fly control, vaccination, teat seal, and/or dietary supplementation to prevent these infections from occurring. Unfortunately, prevention is never going to be 100%. So you also need a treatment program to cure those existing infections that have not been prevented. And you have the option of dry cow therapy or lactating cow therapy. Because again, our goal is to have these young animals fresh and free of mastitis with low somatic cell counts and maximum milk production for maximum dollar profits for the producer. Thank you for your attention.
Thank you very much, Steve, for that excellent presentation on how to manage mastitis in bred heifers. I'd like to ask that the audience think about actually filling out our survey that we have as far as what they found useful in this particular webinar, and also future webinars that they would like to see. The link is here, or you can type that into your actual web browser. This information is very important to us because we actually use this as far as planning future webinars and how we can improve and meet the needs of our audience. Again, Steve, I'd like to thank you on behalf of DAIReXNET for presenting this material and also for support of DAIReXNET.
You're very welcome.